of additional information in terms of the projections. Is, as Waziri has clearly stated, is that the numbers will increase as we approach our peak. And if the numbers increase, of course, even the deaths will significantly increase. But more worrying, of course, is deaths, especially in those without coexisting medical conditions. Like for today, we have reported 7 deaths. Out of these, there are 2 people who didn't have any coexisting medical indication or condition. So that is usually a source of worry for us, because then it means either the infection is they are getting a more serious form of the infection, which therefore means that we need to be able to warn the young people that not everybody who gets COVID, you could be that unlucky person who gets a more serious form of COVID-19 and therefore succumb to it. So it is imperative that the young people take these precautions very, very seriously. Initially, in early phase of the disease, you remember most of the people who died had coexisting medical conditions. But also as the numbers rise, the healthcare system, in line with the directive of His Excellency the President, that each county establishes a 300-bed isolation facility, a number that very many counties have indeed exceeded. The healthcare system has been resilient and people are still able to get services. So we are pleased that on the 10th day following the lifting of the restriction of movements, so far the healthcare system has responded very, very well. As of today, we have 1,049 people admitted across hospitals in the width and breadth of this country. And out of these, 39 are in ICU, with 21 of them under ventilatory support, meaning we are breathing for them through machines, and 18 requiring supplemental oxygen. So the number has not changed significantly in the past 3 days. So we hope that scenario will obtain going forward. There was a question in terms of sports, which Waziri has also articulated too, but CS Mina Mohammed, CS for Sports, has formed a task force to which MOH is a member, to be able to provide technical expertise in development of protocols and guidelines that will enable us to resume sports activities while assuring safety, public health safety of the Kenyan people and the individual athletes. There was a question of Pumwani. Yes, yesterday I was in Pumwani with my dear sister to my left, and on a fact-finding mission, and we indicated that 41 out of 290 healthcare workers had tested positive for COVID-19. 2 had subsequently recovered and been removed from isolation, but 39 were still on home-based care isolation in various places in Nairobi. And the support that the ministry has extended to them includes, in our meeting yesterday, the need for further capacity building and sensitization of the healthcare workers on case management, provision of additional personal protective equipment for safety of the healthcare workers as they deliver on their mandate. We are also ramping up infection prevention control guidelines in the hospital, the issues of hand washing, use of sanitizers, masking, and of course physical and social distance, including closure of common areas where healthcare workers tended to gather, like the tea room near the labor ward. The hospital has also, in conjunction with Nairobi Metropolitan Services, established an isolation facility for healthcare workers who may not qualify for home-based care, and of course will continue to offer them continued psychosocial support during this difficult period. But of note is that these 39 in Pumwani, none of them were symptomatic and none of them had any underlying medical condition. So we are very, very hopeful that they'll be able to pull through. Yesterday and today, again, we commenced testing of the remaining 100 healthcare workers. So the total complement of about 390 healthcare workers in that institution will be tested for COVID-19, and the same measures will apply in case anybody turns positive. The issue of recoveries, I think Waziri addressed that very, very conclusively. But also to be able to add to that is, of course, we continue to offer them psychosocial support, advice on nutrition, the kind of foods to eat, and of course the need to maintain other infection prevention control measures that apply to all of us. The status of backlog, yes, again, I want to confirm we don't have any backlog of cases because in the past 3-4 weeks, we have had sufficient quantities of test kits and reagents, and therefore we have tested as we pick the samples. But as countries move on again to reimpose restrictions, like what is happening in America, going forward there could potentially be challenges in terms of acquisition of these important commodities. So we could again get into headwinds going forward, but we'll always do our best as a government to ensure that our testing is sustained. There was a question of the vaccines. Yes, something exciting coming from Moderna, which is a biotechnology company in America, using a totally new approach to development of vaccines. They're using part of the virus, inject it into your body, and that particle is called mRNA, messenger RNA, which stimulates the production or formation of a protein that is found in corona called a spike protein. This spike protein is like a pin that enables it to attach to and infect the other cells. So once it infects the other cells, then your body naturally, because this is a foreign antigen or a foreign body, produces an immune reaction leading to formation of antibodies. And it is this that we need, because these antibodies then, if you form them in sufficient quantities, if you then get into contact with the real coronavirus, then the antibodies will be able to neutralize it and prevent you from getting infection. So this Moderna vaccine has gone through phase 1, where it was tested in just a small number of people to look at 2 issues. One is safety, and of course number 2 is whether you develop an immune reaction if you are given the vaccine. And out of the 45 people who are given the vaccines, all of them developed an immune reaction. They produce antibodies. Of course, the highest antibody production was noted in the last group, which was given a higher dose of 250 micrograms. But also because of the higher dose, they experienced the greatest side effects, including headache, muscle pain or myalgia, fever, nausea, and delirium. So going forward, a 250 microgram dose will be pulled off as we go to phase 2, where we are now going to test the vaccine in thousands of people. You remember we started with 45 in batches of 15. So now we can go into hundreds and thousands. Then in phase 3, you continue again to monitor for safety and immune reaction in hundreds of thousands. So this going forward is good progress, but again with a caution that even if you are to get the virus, of course, probably the people in the first world will be able to access it first before it comes to the developing world. And you have seen the kind of protectionist measures that the countries have put in place. So we think going forward some countries will insist on those tendencies. But the natural best thing to do once you develop the vaccine is to avail it to everybody. Because corona anywhere is corona everywhere. I think that is all for today. Thank you.